snoring, sleep apnea, clenching, grinding, TMJ and face pain, headaches, asthma, tongue tie, thumb sucking. Chances are you suffer from one or more of these conditions, and I'm positive that it impacts the full potential of your life. Welcome to Myofunctional Pathways, the podcast, where we'll delve into all topics related to airway and myofunctional therapy. We help people find relief to problems that other treatments may not have helped with. Join us as we explore the ever-growing world of myofunctional therapy. We have one goal in mind: helping you to live your best life. We help you sleep and breathe deep. And now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition. Hello. So today I would like to discuss seasonal allergies and myofunctional therapy and nose breathing and why and how all of these things are connected. So I am in Wisconsin. I'm in the upper Midwest, and it is almost the end of March. Well, it is the end of March, and it's 33 degrees outside. But like most people in the rest of the country, we've had a really, really mild winter when it comes to temperatures. So we started seeing budding on the trees and tulips and daffodils coming up in February already. And I know a lot of people around the country have also experienced the same kind of early blooming because the weather's been so mild. So today I want to focus on talking about allergies, seasonal allergies, and also how myofunctional therapy and nose breathing helps with allergies. So let me give you a little bit of background first about my allergy struggles. I was a kid who was constantly sneezing, constantly blowing my nose, itchy, watery eyes. I was miserable all the time. And growing up in the 80s and 90s, it wasn't as normal or as common as it is now for kids to be taking allergy medicine all the time. So a lot of times I just suffered. And it really, really sucked. I'm not going to lie. So I pretty much lived my entire life with my mouth hanging open because I couldn't breathe well through my nose. When you start to have an allergy process, the tissues inside the nose start to get inflamed, they swell, they enlarge, and it gets harder and harder to breathe adequately through your nose. So when that happens, what do we have to do? We have to open up our mouth so we can breathe, right? If you know me, you've heard me talk about this before, and any myofunctional therapist will tell you the same exact thing. The nose is a use it or lose it organ. So the less you use it, the harder it's going to be to reuse it and start to get it functioning again. The nose is the ideal way to breathe, and it's really the only organ that is designed to take in air. So inside our nose, there's bones, they're called turbinates, and they're layers of bone that are covered with soft tissue. Part of their job is to help warm up the air and filter the air before it gets into your lungs. So the nose is designed for breathing, okay? I already said that. First thing is going to happen is the air goes through the nose. It gets filtered by the turbinates. The little hairs inside the nose help to trap dust and allergens and pollen and other things, animal dander. You also have a lot of mucus in your nose, and the mucus is really responsible for trapping a lot of those pathogens as well, so that they can be blown out when you blow your nose. If we're bypassing that whole process and we're just breathing through our mouth, everything directly hits the tonsils. And a lot of times we have increased tonsil size, inflammation of the tonsils, and they become, in some people, they become so big that they really don't help in the immune process, okay? I saw this, I forget where I even saw it, but it was a great analogy that the tonsils are to the immune system what a white picket fence would be to an invading army. Oh my gosh, I forget where I heard that from. but it made the most sense because there's a lot of resistance about wanting to have tonsils removed. And I understand that, okay? But I had to have my tonsils out when I was 28 years old. And I had my son's tonsils taken out when he was age 6. So he's 7 now. But let's talk a little bit about that. And I gave the introduction to why the nose breathing is ideal, what the nose does for air before it gets into our body. So as I started with, I was the kid with the really bad allergies, like snot everywhere, constantly sneezing, itching my eyes. It was misery. I was always like snorting and, like snot. It was really gross. My sister used to get really mad at me and she'd yell at me all the time. Fast forward to an entire lifetime. So when I was in my late 20s, so I was 28 years old, I ended up having my tonsils out. And when they say that having your tonsils out as an adult is horrible, it really is. Like I can 100% attest to that. It is absolutely excruciating. Am I happy I did it in the long run? Yes, I am. Because as a kid, I had tons and tons of strep throat, like all the time. I had the really big tonsils that had the huge holes in them, and I'd get tonsil stones. And if you have problems with your tonsils, you know what I'm talking about. These tonsil stones are basically little balls of bacteria in food and just grossness that accumulates and condenses into a little tiny stone, and it traps itself in some of these big holes that we sometimes have in our tonsils. And I would literally use a Q-tip or something and try to scoop them out. And they're pretty gross. And they smell bad, and your breath smells bad because it's literally bacteria festering, and it's hard to get rid of. So anyway, I had tons and tons of strep throat. And then because I've had allergies my whole life, my mouth was open all the time. So my primary mode of breathing was through my mouth. Now, a lot of people breathe through their mouth, and just because we see it a lot does not mean it's normal. Your mouth is not designed to be a breathing organ. It's an amazing emergency hatch. It's an emergency hole in our face, literally, that we can take air into so that we don't die. But the mouth is not designed to be a breathing organ. And I'll get into this a little bit more on another episode and talk about the detrimental effects of mouth breathing, okay? But today we're talking about the nose and allergies. So my mouth is open my whole life, and I'm not using my nose. And my nose continues to get more and more swollen and more congested, more stuffed up, and I literally can't breathe nose. I'm breathing through my mouth all the time. So I had so much strep throat and so many sinus infections in my life that finally, when I was 28 years old, I got to the point where I can't live like this anymore because I was on antibiotics all the time. And antibiotics, they're great for killing bacteria, but they're not great for your gut bacteria that helps with your immunity, your immune system. But not only that, the antibiotics were just a Band-Aid. Because you take the antibiotics, you kill or reduce the bacteria, you feel better for a little while, but guess what? The problem was never addressed. So you're going to keep having the same things happen over and over and over. And that was me literally for the first 28 years of my life until I decided to get my tonsils out. So I got my tonsils out, and that was 14 years ago. I've literally had strep throat once in 14 years. And that happened to be last winter of 2020 when I was lucky enough to get flu A, and then I got flu B, and then I got COVID, and then I got strep throat all mixed in there. And I was sick for pretty much 2 months straight, and it really sucked. But that's the only time I've gotten strep throat since I've had my tonsils out. Okay. Remember what I said earlier. Your tonsils to your immune system are like a picket fence to an invading army. Yes, they have a benefit. Yes, they're important. But in the grand scheme of your whole immunity, they're very tiny impact. So I was okay with taking my tonsils out. All right. So we're going to fast forward to about 5 years ago. The tonsil problem went away because I had the surgery, and the strep throat problem went away, but the allergies don't ever go away. So I'm still breathing through my mouth. No one taught me how to breathe through my nose. So I didn't really know that this was a thing. until 3 years ago or so when I started studying myofunctional therapy. So allergies, I controlled them. I controlled them with medicine and different things, but I was still breathing through my mouth because now I've been doing that for 30 something years, and that's what I know. Again, that got so bad, I kept getting sinus infections. There was one period of time right before I had a sinus surgery where I took antibiotics 5 times in a 6-month period, and that was brutal. We talk about the allergies, or we talk about the effects that the antibiotics have on your stomach. Oh my gosh, it was brutal. They tell you to take probiotics, for diarrhea and things like that because you're literally killing all that good bacteria. So I got fed up again and I went to my ENT and I'm like, listen, I can't keep doing this. What's going on? Why does this keep happening? So they did a CT scan of my sinuses and they were so clogged up and so inflamed and so enlarged that there was literally no room for the sinuses to drain. So I kept taking the antibiotic and it helped, but very, very short term because it was just a Band-Aid. It was not addressing the root cause of the problem. So until I did a structural thing to help my sinuses, I could take antibiotics for the rest of my life and it wasn't going to get rid of my sinus infections because there was literally nowhere for the bacteria to drain out of my sinuses. Okay. I went in, this is about 5 years ago. I had my sinus surgery. So what they did was they reduced the size of my nasal turbinates, which are those bones that are inside your nose. They had to shave those down. And then they also went in and they removed all the little thin bony walls that separate the sinus cavities. They did not have to fix a deviated septum. So sometimes a deviated septum is part of the problem or it contributes to the problem. But in my case, I did not have a deviated septum, so they did not have to correct that. And then the other thing that they did was they took a couple little balloons and they did a frontal sinus, a sinuplasty, where basically they use these little balloons and they fish them up into the small sinus cavities that are right by the corners of your eyebrows, and they enlarge them so they have a bigger capacity. They dilate them, and that allows for better drainage. So, okay, I had this surgery 5 years ago, and guess what? I mean, it helped tremendously. So don't think it didn't. And it changed my life in a lot of ways because now I could get my nose back to functioning the way it's anatomically supposed to. I have really, really bad allergies. I've taken the skin scratch tests a couple times in my life, and they always come back being positive, highly positive, very reactive to 48 out of the 50 things that they test for. And I think the 2 things that I didn't test positive for were guinea pigs and rabbits. Pretty much every kind of mold, every grass pollen, every tree pollen, animal dander, you name it, it causes me trouble. So what I've had to do now is really think about how I treat my allergies because you can't really make allergies go away. You can meet with an allergist or an immunologist who can set you up with allergy shots and things like that, or IV infusions. In some cases, it can help eliminate the allergy, but that doesn't really seem to be the case, at least from people that I've talked to. But I'm not a doctor and that's not my specialty, so I won't say much about that because I don't really know. But when you're allergic to that many things, it doesn't make sense to really spend that amount of money and time to have all these shots because all it takes is one allergen, one allergy to trigger everything. So unless you're in a position where you're going to treat every single thing, to me, it didn't make sense. So I didn't do that. I can breathe through my nose now, which is fantastic. I mean, it's life-changing, and I'm not even exaggerating when I say that. If you've been someone who's breathed through your mouth your whole life, and then all of a sudden you can breathe through your nose, it's like, oh my gosh, I feel better. I'm sleeping better. It's really life-changing, okay? I do get sinus infections maybe 3 or 4 times a year, where in the past it was like every couple of months. So the frequency has really reduced. But the one thing I do now that's much different is I pay a lot more attention to nasal hygiene. So let's talk about that, okay? I use a neti pot or a squeeze bottle that you can put one of those little sachets, those little packets of saline in. It's like a powder and you mix it up in the water and you squirt it into your nose. there's a certain brand that I really love. I love this brand. And let me tell you again, I am not endorsed by any company to talk about any product. These are all just my own personal experiences that I'm sharing with you because this is what worked for me. So do your research and find an over-the-counter product that you think is going to work the best for you. So I like the brand called Clear. It sounds like the word clear, that's how it's pronounced, but it's spelled with an X instead of a C. So it's spelled Xlear. And they sell that in nasal sprays. They also have those packets that you can buy to mix into a bottle or a neti pot. And I really, really like that brand because it's not just saline. Now, saline alone is really great because it's going to help to cleanse the mucous membranes in the nose. It's going to help to flush out bacteria and viral particles and fungal particles and allergens. But the reason that this brand it starts with an X instead of a C is because they also use xylitol in their product. Most of us have heard the term xylitol before. It's really highly used in sugar-free products, and it's very highly utilized in dental products because it actually has the ability to kill germs and bacteria and cleanse the nose. And not only that, but it helps to create almost a barrier that's going to help prevent the bacterial and viral particles from sticking inside your nasal cavity. It's a saline nasal spray that's mixed with xylitol, and it really helps to thin out mucus, and it really soothes the irritated nose as well. Saline can be a little bit more drying. It can dry the nose out a little bit more, but whichever thing you choose to do, you're still going to be helping to clear allergens and reducing congestion and inflammation. So it just really comes down to what you like. It's really nice too because a lot of over-the-counter, even prescription nose sprays, they become habit forming. And when I say habit forming, I mean that they can create what's called a rebound effect. If you read the instructions on a lot of the nasal sprays, they may say don't take for more than 3 days, or your inflammation and your congestion can actually get worse. That's the rebound effect, basically, where if you use the product for too long, the body is going to be like, oh, okay, now we need to overcompensate and we need to make more mucus and congestion than we had to begin with. And there's no way that we want that to happen. That's the exact opposite of what we're trying to do. We want to try to reduce the inflammation. So what's nice about XClear, per their website, is that you can pretty much use it all day if you need to, anytime you need to. It's non-habit forming. It's not going to cause a rebound inflammatory response. And it's just really, really effective during allergy season. So what I do is now in the upper Midwest here in Wisconsin, my allergies are really starting to kick up. So during this time, I will usually use my nasal spray like twice a day. I'll do 2 squirts in each nostril twice a day. Once when I wake up in the morning, before I take my shower, and then again, usually about an hour or so before bed. And the reason I like to do this before my shower is because I'll usually hang out and drink my coffee and just chill for about an hour, and then I get in the shower. But I really let everything kind of penetrate into the mucous membranes and up into the sinuses. And now when you get your nice hot shower, what happens? Everything gets loose, right? So it's easier to blow everything out. So for me, that really works. But you do it whatever feels right for you, whatever works for you. And then likewise, I do it again about an hour before bed, so it has time to kind of penetrate. I try to blow everything out before I go to bed. And then I wake up in the morning and I'm so much clearer. I have so much less congestion. So if you're someone who has a lot of nasal congestion and allergies and stuffiness, you're going to really appreciate this, and you're going to know exactly what I'm talking about once you experience it, okay? Now, the reason that this really combines with myofunctional therapy is because even though I had my tonsils out and I had my sinus surgery, still nobody talked to me about why it's important to breathe through my nose. The ENT, the ear, nose, and throat doctor, as prevalent as myofunctional therapy has become, when you talk to them about it, they just don't understand it. Okay? And it's not that there's anything wrong with that. They just didn't learn about it. But the part that I think bothers me just a little bit is that my ear, nose, and throat doctor did not instruct me or educate me on why I should be breathing through my nose. There's 4 main goals of myofunctional therapy. The first one is you have to be able to breathe through your nose. If you cannot breathe through your nose, there's nothing that's going to help you. Myofunctional therapy is not going to help you. Wearing, night guards at night is not going to help you. You have to be able to breathe through your nose. Okay. Number one. Also, what happens when your mouth is closed and you're breathing through your nose is that your body is creating the gas that not many people are aware of, and it's called nitric oxide. And nitric oxide is primarily created in our sinus cavities. And nitric oxide is antibacterial, antifungal, antiviral. It's going to help kill off a lot of the germs and viruses before they have a chance to really embed into our tissue and make us sick. Our body does this. Our body makes this gas, okay? If our mouth is open all the time and we're not making this gas and we're not utilizing it, we're much more likely to get sick much more often. And I am positive that this was a big part of my story because I wasn't breathing through my nose. The nitric oxide also helps to reduce inflammation, you guys. Reduce inflammation. If your nasal cavities are so inflamed that you cannot get air through your nose, your mouth is going to open and then everything is going to snowball on itself. So the myofunctional therapy is going to help to retrain the muscles that are involved in swallowing and breathing, and this includes nose breathing, okay? When we have poor oral rest posture or our tongue is in the wrong position in our mouth or it doesn't work as functionally as it should, the mouth opens, and this can actually worsen our allergy symptoms and our congestion, and we're more likely to have postnasal drip. So we need to improve the function of the muscles to be able to improve the symptoms, okay? But if there's a structural problem, we need to also think about that and talk about that. When I say structural problem, I'm talking about what does the upper jaw look like? What's the shape of the upper jaw? Is there a deviated septum? Is there big tonsils or adenoids that are preventing you from breathing through your nose? Again, if you can't breathe through your nose, not much else is going to help you. So sometimes we have to take that extra step and have a procedure that's going to address the structure. Okay? It's not ideal. I understand that. I've been through it myself, and I had to do this with my own child. Okay? So my son, he's been a mouth breather since he was born. Horrible, horrible allergies. He was getting sick all the time. Kindergarten. First quarter of kindergarten, I think he missed like 9 days of school. And that was the first quarter of school, okay? I think for the whole school year, he ended up missing 13 or 14 days. And most of that was like for cold and flu type of symptoms. Couple of stomach things here and there, but that's not quite as related. That's a little bit different. But this year, it's March 24th today, and the school year is going to end in March, April, May, June, 3 months. He's literally missed 1 day of school, and that was because he had a stomach bug that everyone else had. He missed 1 day of school, and the school year is almost over. His mouth was open all the time because he couldn't breathe through his nose. So my poor little baby, he's 7 now. So this just happened a year ago, last spring. He had surgery to reduce his turbinates, just like mama did, just like I did. He also has a deviated septum, but it's very minor and they didn't need to repair it. They took out his tonsils and they took out his adenoids. And he can breathe through his nose amazing. And now I have him in a device that he wears at night that helps his upper jaw stabilize the shape of that. And we'll talk about that in another episode too, how the upper jaw plays a role on your nasal breathing and a possible deviated septum. The problem with him though is that his jaw is so high that it's hard for him to keep his mouth closed. So he can breathe through his nose, but it takes a lot of reminders. And there's still a structural component that I need to address with him, and that's his upper jaw. Okay. And we'll talk about that down the road, but that's why he still has difficulty. So when you're doing myofunctional therapy, we look at things from lots of different perspectives that maybe other providers aren't looking at. And in order to get you the best results for, the best therapy outcomes, we often have to consult with and potentially work with other types of professionals. Sometimes you may need to see an ENT and make sure there's no structural problems. Sometimes, it may be in your benefit to have a sleep study to make sure you don't have sleep apnea or upper airway resistance. So we're going to give you all the information based on all the observations that we see, and then we'll recommend providers in your area that are going to help you achieve your goals, okay? The moral of the story is that if you cannot breathe through your nose, nothing else is going to help you. And sometimes I will actually postpone working with clients because the mouth breathing is so severe that we have to rule out a structural problem first, because I don't want to start working with them. It's going to be a waste of their time and their money if you can't breathe through your nose. Let us know what you need help with, and we will talk to you soon. Have a great day. Thank you for listening to Myofunctional Pathways, the podcast. As always, you can find us online at www.myofunctionalpathways.com. We're also on Facebook under Myofunctional Pathways. Instagram is myofunctional.pathways.llc. And you can also find us on TikTok and LinkedIn.